Hi, it's Dr. Somji from Nip Talk. We talk about everything in cosmetic surgery, and one of the most common questions I get asked is how can I improve this neck area? I'm quite young and I've still got some looseness of skin in this area, and I don't want to have surgery, and I've had things like fillers in this area to define this region, but still my neck is really quite loose. What can I do? This is a question that a lot of people face, and this is what I see every day in my clinic. So the first things first, if you've got an area over here when you're sitting in the side, like me, you've got not a great angle that sits there, and you're constantly on your phone like this, you're going to put pressure on this area. Just note that the neck region doesn't have any bone really to attach to. So it's not like the face where we can sleep on it and it stays nice. In the neck area, it can get really loose really quick. And also, in an age where now people are going on a number of diets and fad diets, weight goes up, weight goes down, then suddenly the skin looks a lot looser within this region. So I get patients now, even very young patients, late 20s, mid 30s, early 40s, saying to me, I don't want a neck lift because I don't want a scar, i.e. a surgical neck lift, and I've had things like filler in this area to define this area, but it's still, when I look down, I've still got this area. So a number of patients go down a few different pathways. Putting too much filler in this area is going to make you look a lot more masculine and a lot more square. It'll look really good on an Instagram before and after, but in real life, you'll look like an alien. So it really isn't the best thing to be doing. Secondly, I've seen a lot of patients now having lipolysis injections within this area. Most of the time, this is not fat. We have good fat within the neck region, and if you inject and substance that's going to dissolve fat in this area, you may end up in a worse position than you were previously. You may end up with very loose skin here, and that's something that you may see even in advanced years, and then you definitely will need surgery. So what are the alternatives within this region? Well, let's go from the most least invasive to the more invasive elements. So the most least invasive way of doing this is through energy-based devices. So radiofrequency is a great technology to use within this region. You can take down this little area and you can tighten skin. So if you tighten skin within this area, it will just bring this in slightly. You do need multiple sessions, but it's something with reduced risk, and will also, especially if you're younger, will be a lot more appropriate. Next, you can create a little meshwork within this area. So if you've got a little bit of fat within that region, then sometimes you can inject some threads within this area, so PDO threads, and even a kind of more longer lasting threads called PLLA threads, and almost structure it like a mini basket within this area just to tuck this bit in over here. So that's a little bit more invasive, but they dissolve over time and they generate nice collagen and tightness within this region. If you do have a little bit more fat there, then sometimes taking this fat down is an alternative. But remember what I just said, you don't want to take fat down without tightening the skin, because you'll be left with loose skin in this region. And this is the reason why that if you do decide to have maybe cool sculpting or cryolipolysis within this area, tightening the skin afterwards with a series of radiofrequency sessions is going to be really important. Sometimes if somebody says to me, look, Dr. Somji, I've seen your before and afters on Instagram, I want it gone like that patient, then you may need to have something a little bit more invasive. So I do a keyhole neck lift through like a 2mm small incision, so almost like how a filler needle is, and I pass a stitch across this area, and it's basically tightening up the muscle that sits underneath the neck to just almost like we said, a basket to suck this area in. So if you do this, that's the element that you get. Now that's pretty much permanent when you put one of those in. You can use this through kind of permanent sutures, and there's even more of an elegant method of this called the elevate procedure as well. So all you get is no scarring, but it's a nice lift within that area. I tend to use it for slightly older patients that have got more of a degree of relapse in this area, and it does lift it quite nicely, and you get no scars. Secondly, in terms of more of a surgical, more invasive setting, sometimes if you've got a little bit of fat in that area, we can use that fat for your advantage. So we can, if you imagine you've got a brick wall and you've got two bricks that are sitting like this, and you've got the cement in between, that's exactly how fat cells sit underneath the skin. Sometimes, even after the age of around 19 or 20, those fat cells sometimes go like this, especially if you've lost weight and you've gained weight, there's more of a separation. What we want to do is tighten the cement in between, and this is where a little bit of liposuction in that area with energy-based devices, so surgical-based devices called face-tight, cause what we call septal contraction. So it tightens those two fat cells together. Now remember, you've got the skin over the top, so if you're going to be tightening this, your skin's going to get tight too. So you can use that fat to your advantage. If you've got a little bit more fat, yes, a little bit of a liposuction, but over the top, you can tighten the skin with things like face tight. And that's a great combination treatment. Sometimes, if you've got the looser muscle, where you kind of bend down, and you've got the fat, and you've got excess skin, then maybe you can use all three. So you can tighten the muscle with the stitching like we talked about. You can also tighten the fat cells with the face tight. And if you've got a little bit of fat in this area, you can also liposuction it as well. So again, like with anything that we talk about on this channel, it's a more tailored approach. And we're going to have separate videos for each of those treatment modalities, so you can get a bit more of an understanding about the finities of each technique. So if you enjoyed that video, click like and subscribe. If you want me to feature anything else on the channel, any new topics or any further clarification of any questions, just post it in the comments below.